presenter.
Thank you, Gail. I have a pleasure to introduce Kristen Lilley, is the Executive Director, Medicines for Humanity, which has increased its impact by evolving from being a supplier of medicines to strengthen systems of clinics-based clinic-based and community-based care. Kristen has more than a decade of experience working in international public health and was the program manager for Latin America and Caribbean projects for Medicines for Humanity before becoming the executive director. Prior to her work at Medicines for Humanities, she developed and managed maternal child health projects in rural Africa and Haiti for an international NGO focused on human services. Welcome, Kristen.
Thank you. Thank you for having me today and for all of the wonderful presentations that we heard. I'm going to share my screen. Okay. All right. Thank you it has been so encouraging to listen to everyone's presentation this morning. And there's so much I'm sure everyone could share. Similar to others, I'm going to share a little bit about Medicines for Humanity, what we do globally, and a specific program that we have to build the capacity and strengthen services for sisters around the world. Medicines for Humanity is a global nonprofit. We are based in the United States. Here we go. We're based in the United States, but all of our work is outside in developing countries. Our mission is to save the lives of vulnerable children and their mothers. So we focus on maternal and child health care with partners that are already working in developing countries. Our founder was interested in working with local partners instead of building a separate system. And so as he was doing work with different organizations and traveling internationally, he realized what Sister Irene said earlier, that the sisters are in many rural locations. They are touching almost every part of the globe and providing services with so little resources. So he developed Medicines for Humanity to connect sisters with primarily, as Sister Annalise mentioned, first starting with connecting to get medications, but then over the years, we have transformed to really supporting local providers and many sisters to improve their clinical services and community-based services with the goal of reducing child mortality and improving maternal and child health. Currently, we are working in 7 countries. Here's the list of countries where we are right now. We have partners in Cameroon, the Dominican Republic, the Democratic Republic of Congo, Haiti, Malawi, Sudan, and Zambia. We've worked in several other countries, but as been mentioned, with the ebb and flow of funding and what's available, these are the 7 countries we're currently working. Our goal is to partner with local providers, as I mentioned, and provide support in various areas that they need. So we focus on improving clinical services that comes in the form of making connections for some of those medical donations or purchasing and helping sisters connect to medications that can be purchased in country, improving clinical skills and clinical services, connecting providers to the local Ministry of Health so that they can get vaccinations and support of what's coming through the government. So making sure that they have the best and most updated technical capacities in clinic services for mothers and children. And then we focus a lot on the connection between community health workers and the clinics. So we support sisters who are developing community health worker programs, who are building the capacity of their community health workers to reach out to the community, to provide education and support, and then connect those families back to the clinic to know when they need to come to the clinic for care and how they can access the clinic where many of the sisters are. We have a large focus on nutrition as well. Nutrition and health are very closely linked, and a lot of child deaths are related to malnutrition. And so we support nutrition programs at a clinic level, providing malnutrition treatment at clinics through providers and sisters. And a lot of what Sister Florence just talked about with connecting in the community, doing home gardens and cooking demonstrations, teaching families about how to utilize the produce that they grow and sell it when possible. We do some water and sanitation work in getting clinics up and running with water facilities, clean water, making sure there's hand washing and running water at the clinic, and some community water sources as well. So we do some water and sanitation programs. And then we have always had a large focus on capacity building and strengthening the knowledge and services for local providers and sisters. So we developed a program in 2019 called Learning for Humanity. This was right before COVID started, and actually was perfect timing and took off during COVID because everyone was virtual and getting used to being on Zoom, which is now the norm. But we developed this program, Learning for Humanity, because we did a lot of training with sisters in country where they had to come to an in-person training. And we heard a lot of sisters, we work in a lot of areas where there is violence and insecurity. And so a lot of sisters were having trouble coming to those in-person meetings. And they also couldn't take that much time away from their facilities. So while there are so many amazing opportunities for capacity building and strengthening among sisters and for sisters, it's hard a lot of times for those sisters to come and spend that time together. So based on those needs and things we were hearing from our partners, we developed Learning for Humanity as an online resource for sisters to take courses and to develop their skills and their capacity in different areas. So we used a human-centered design approach to ask the sisters, what is it that you need? What prevents you from going to some of these trainings? What kinds of things are you interested in learning? And we found that a lot of sisters that we surveyed across the globes in the countries we work, but also other sisters we were connected with, said that many of them were trained on those clinical skills. They were trained as a nurse or a doctor, but they weren't trained on human resource management or doing budgets. And then they were put in charge of a health facility, but weren't given as many skills on how to manage that facility well. So many sisters asked for areas like that: leadership, human resources, budgets, how to manage and grow a program and look for resources. So Learning for Humanity started to design these specific courses based on that feedback, and developed an online platform where sisters can log in. They find the course that they're interested in, they log in, and then they take courses on their own. So it's about 4 to 5 hours a week that we ask sisters to commit to taking these courses. They're very interactive. So there's information that they read. There are case studies on sisters that we've worked with and connecting the dots and showing what other sisters have done, videos and matching activities to make it fun and exciting and interactive, so it's not just reading a bunch of information online. So we have developed that where they can do this online learning themselves, and then there's connections with other sisters across the globe. So we have learning groups where we connect sisters on WhatsApp. There are discussion boards on our platform, and there are interactive sessions where the students in one class come together. A lot of times they'll hear from an expert in the area of what they're studying. So healthcare management, for example, they'll hear from an expert in healthcare management, have a short lecture, and then have a chance to interact, ask questions, and connect with each other. This is a great opportunity for them to learn from one another, for sisters to share their ideas, similar to how Sister Irene mentioned, for them to show what they're doing in their communities and how that might impact or help another sister globally. As I mentioned, this platform was primarily designed for Catholic sisters, but it's also very useful for their staff and for local healthcare providers that are working in many rural locations that have a hard time accessing continuing education. So right now, 8 out of 10 of our participants are Catholic sisters, and we had over 900 students enrolled in different programs this last year from over 30 countries. So this has been a wonderful opportunity. While we as Medicines for Humanity have direct programming in 7 countries, Learning for Humanity has given us the opportunity to connect with sisters from 30 different countries to figure out what they're doing, hear from them, design these courses and these sessions based on their feedback, and for them to connect to one another. Primarily, the courses that we offer, I'll show you next what is available, but it's primarily meant for sisters who are working with women and children, primarily in hospitals and health facilities, since that's our focus of area. But we have had sisters from orphanages and schools and just managing elderly homes in their communities that have benefited from our courses in leadership and management and budgeting. So here at the moment, we have 12 learning paths. That's a compilation of courses, create a larger learning path available. We have them available in English and all of them available in French. And then we have several courses available in Spanish, and we are working on improving the number of courses we have in Spanish as well. A few that we have offered are healthcare management, pharmacy, maternal and child health communication, how to develop a community health worker program and run that. Advocacy, we've connected with some other sister groups like Network and other groups worldwide that are providing education and support to sisters on how to advocate. How do you advocate at a local level within your congregation, within your community, and then how can that be useful on a larger scale as well? And then a course I want to focus on is this last one, proposal writing and grant management. I think this fits in really well with what we've been talking about getting resources. A lot of sisters that we work with have told us that they don't feel confident in writing proposals. They don't know where to start. They don't know where to look for funds. And we know that we have connected with other groups that have said that they have resources available or they're helping sisters to learn that. So this course in proposal writing and grant management brings together resources from other partners that we've worked with, like the Hilton Fund for Sisters and other funders that we've asked for feedback that tell sisters some practical skills in what should you do to start writing a proposal? Where do you start looking for funding? What are some of those areas that we can say, okay, this, we have a resource page there that tells sisters where to look for funding, how to know whether an organization or a foundation aligns with your goals and your mission, your areas of focus. I love the platform Sister Irene shared because you can click on those different areas, health, education, things like that. So this course helps connect that as well and teach sisters how do you look for that funding. And then what do you need to be prepared to write a proposal? We have a template that teaches sisters. These are generally in most funding proposals. This is what you need to have ready and be prepared and how that can be tailored to your different project. So that course is wonderful in teaching sisters how to look for funding, how to write that proposal, and then also once you get a grant, how to manage that. What does that look like in getting your grant, communicating with a donor? What does reporting look like? And things that should be considered throughout that process. One thing that's not included here, but we're developing, we've had some generous donors who have helped support a new mentorship program that we're developing this year. And so sisters have, like I said, they've been connecting with each other, but sisters have asked for more support in mentoring them for with each other, and to, like Sister Florence just mentioned, having a mentor who can sit with you and say, here are areas to develop, here's how you work collaboratively to develop a program and to figure out how to keep that sustainable. So we're designing a mentorship program that will include a course on our platform as to what is included in mentorship. And then we're starting with group mentorship. So sisters, we're piloting this with sisters in Haiti and in Africa who've already been taking our courses, but piloting with them to do a group mentorship session where they get more individualized advice and discussion. And then they mentor one another as well and have that support within their small groups. And we will be in the next year, we're rolling this out with those groups. We're piloting, we're going to make changes based on their feedback, and then we will have mentorship available for anyone who wants to sign up. Our future goal is to have one-on-one mentorships. We've been trying to work with Catholic Health Association and other groups who are interested in having pairing mentors with sisters in developing countries and helping them have that one-on-one mentorship so they get more individualized support. So that's our goal for the future. Learning for Humanity is, as I mentioned, you can go online. I'll put the website in the chat, but on our webpage, you can learn more about Learning for Humanity and look at the courses that we have offered. We do charge a small fee of $50 per course, and that's primarily to keep this as sustainable as possible and make sure that we can keep the program running. However, we do have a lot of scholarships and opportunities available. So we have some funders who have given us money to allow sisters to take courses for free. Our board has covered the cost for sisters in those 7 countries where we work. And so if you are in any of those countries, the course fee is covered by Medicines for Humanity. But if you're interested in taking a course, you can reach out to us and we can discuss scholarship opportunities and see what would be a best fit for you. So it's a great opportunity to connect with other sisters and to learn more in areas that you're interested in developing, and then learn more, like I said, on how to develop proposals and manage a grant. So that is the very quick overview of Medicines for Humanity and our platform, Learning for Humanity. I will, again, type our website in the chat, and if you would like more information, feel free to reach out and connect with us. Any questions?
All right. Well, thank you very much. Sister Ennis, I guess we are now at the point, Kristen, thank you. There are several comments in the chat from sisters who already are working with you. So that was wonderful. And also there's some other questions that we will be answering again in the resources, part of the follow-up you'll get up. Oh, I do see a hand up. Sister.
Thank you for a nice presentation. Actually, we are privileged to have this sharing. We have been missing. So I would like to inquire, is it possible to get some of maybe the email or the contacts of the donors so that we can also try to write the proposal? Because actually all what you mentioned, these are really things within us, but we don't have the capacity to do so. I submit.
So the question is asking if you can get the information for the donors directly, right? Am I hearing that correctly?
Yes.
Yes. Okay.
Yes.
Okay. So
yes.
In our proposal writing course that I mentioned, we do have information about specific donors and suggestions for areas to look for. We've been speaking with the Hilton Fund for Sisters. They have a partner that has an entire book. I actually just bought one, but it's propping my computer up. But they have a whole book on funders that are available. So that, I think, is a more specific question of what kind of funding you're looking for. But yes, our goal is to connect sisters with funding opportunities that they can apply for directly to support their programs. So I will put my information in the chat, and then if you want to reach out, we can connect directly.
Okay, wonderful.